All right, welcome back. Today we're going to try and piece together a pretty complicated health puzzle. It's one that affects millions of women all over the world, but honestly, it's still super misunderstood. I'm talking about Polycystic Ovary Syndrome, or as you probably know it, PCOS. This is where hormones, your metabolism, and even your genes all kind of crash into each other in some really confusing ways. So let's jump right in.
Okay, first things first. Let's just wrap our heads around how big of a deal this is. We're talking about a condition that affects a staggering 8 to 20% of women of reproductive age globally. Think about that for a second. That means it's possible that 1 in 5 women you know might be dealing with this. It's actually one of the most common disorders of the endocrine system, the body's whole network for making hormones, which makes PCOS a major health issue around the world.
And for the women who have it, the symptoms they can completely take over daily life. We're talking about things like totally unpredictable periods, the really heartbreaking struggle with infertility, and some pretty distressing physical changes. Things like hirsutism, which is just a technical term for excess hair growing in places like the face or chest, plus, stubborn acne and finding it really hard to manage weight. It's usually this whole mix of symptoms that finally pushes someone to get a diagnosis.
So, that leads to the big question, right? What is actually happening inside the body that's causing all this? Well, at its very core, PCOS is what we call a lifelong endocrine and metabolic disorder. I know, those are big words, so let's break down what they actually mean.
The name itself, Polycystic Ovary Syndrome, kind of gives you a big clue. For a lot of women with PCOS, their ovaries get a bit enlarged, and they develop these tiny, immature follicles that, on an ultrasound, look a lot like cysts. You'll often hear it described with this really vivid image, a string of pearls. It's a powerful way to picture these little follicles that just can't quite get to the finish line to mature and release an egg.
So how does a doctor actually make the call? Well, it's not as simple as just spotting those cysts on an ultrasound. Nope. To get a diagnosis, you typically need to have at least 2 out of these 3 key things going on. First, something called hyperandrogenism. Fancy word, it just means high levels of male hormones or androgens. Second, those polycystic ovaries we just mentioned. And third, something called anovulation, which is another way of saying irregular or even no ovulation, and that's what causes those all-over-the-place periods.
Okay, so we know what doctors are looking for, but the real question is, why is this happening? What's the engine driving this whole train? Well, it all boils down to this really disruptive hormonal feedback loop. The best way to think about it is like a story with 2 main characters who are totally out of sync, and their imbalance just creates this vicious cycle.
And here they are, our 2 main characters, the core drivers. On one side, you've got hyperandrogenism. Again, that's just too many male hormones, which is behind a lot of the visible symptoms like acne and hair growth. And then on the other side, you've got hyperinsulinemia. This means you have way too much insulin floating around in your blood. And why does that happen? Usually it's because the body's cells start to ignore insulin's signal to take up sugar. So the pancreas, your insulin-making organ, kind of panics and just starts screaming, pumping out more and more insulin, trying to get the message through.
And this is where it all spirals into that vicious cycle. The seesaw analogy is perfect here. So, those high insulin levels, they actually tell the ovaries to produce even more of those male hormones, the androgens. Then, these extra androgens mess with how the eggs develop. But it gets worse. This whole chaotic process can make the body even more resistant to insulin. So what happens? The pancreas pumps out more insulin, which makes the ovaries produce more androgens. And you see where this is going. The cycle just keeps feeding itself, getting worse and worse over time.
But wait, that hormonal spiral doesn't just start in a vacuum, right? It doesn't just pop up out of nowhere. It's actually influenced by this whole tangled web of other factors. So if we really want to get PCOS, we have to look beyond just the hormones. We need to talk about our genes, our environment, and believe it or not, even the health of our gut.
First up, let's talk genetics, because there's a really strong link here. PCOS is what scientists call a polygenic disorder. All that means is that it isn't caused by one single faulty gene. Instead, it's the combined effect of lots of different genes working together. That's a big reason why you so often see PCOS running in families. And what do these genes do? Well, they typically mess with those 2 core drivers we've been talking about, how your body makes hormones and how it handles insulin.
And it's not just our genes. The world around us plays a part too. We're pretty much surrounded by these things called endocrine disrupting chemicals, or EDCs for short. Think about stuff like BPA, which you can find in some plastics. These chemicals are sneaky. They can actually mimic or even block our body's natural hormones, and that just throws the entire system out of whack. And it doesn't stop there. Research is also starting to link things like air pollution and smoking to a higher risk of developing PCOS.
Okay, diet and lifestyle. This is a huge piece of the puzzle, and honestly, this is an area where you can have some real direct influence. Things like diets that are super high in sugar and unhealthy fats, especially when you combine that with not getting enough exercise, well, that just makes that insulin resistance and inflammation so much worse. It's basically like pouring gasoline on that hormonal fire we were just talking about.
Now, this next part is really fascinating, and it's a relatively new piece of the PCOS story. We need to talk about our gut. Yeah, our gut. There's this growing theory that when the bacteria in your gut get out of balance, they call it dysbiosis, it can make your gut lining more permeable. You might have heard the term leaky gut. Well, this allows these inflammatory bits from bacteria to sneak into your bloodstream. And once they're there, they can mess with your insulin receptors and even trigger your ovaries to pump out more androgens. It's this incredible direct link between your digestive system and all that hormonal chaos.
So with this ridiculously complex web of causes, genes, environment, diet, gut health, how in the world do you manage PCOS? The number one thing to get is that there is no magic bullet here. There's no single pill that fixes everything. A good treatment plan is always personalized. It's totally focused on what an individual's main goals are. Is it fertility? Is it clearing up skin? Or is it managing long-term health? The approach will be different for each one.
All right, the absolute bedrock of any PCOS management plan, the first most important step is lifestyle. Seriously. Before a doctor even thinks about prescriptions, the focus has to be on diet, exercise, and maintaining a healthy weight. And why is that? Because these are the things that go right after the root of the problem. They directly attack that insulin resistance and inflammation. And when you do that, you can see a huge improvement across all the other symptoms.
Now, when lifestyle changes just aren't cutting it, or for really specific goals, that's when medication can be an incredibly powerful tool. A doctor will pick a therapy based on what symptom you're trying to target. So for those irregular cycles, oral contraceptives can help regulate things. To go after that underlying insulin resistance, they might use insulin sensitizers like metformin. For symptoms like excess hair, there are anti-androgens that can block those male hormones. And of course, for women who are trying to get pregnant, there are ovulation inducers that can help give the ovaries the push they need.
But the story doesn't end there. Not at all. Science is always moving forward, and researchers are constantly looking for new and better ways to treat PCOS. There's actually a lot of really hopeful stuff on the horizon, therapies that are more effective and more targeted. So let's take a peek at what's coming down the pipeline.
Yeah, the future of treatment is definitely thinking outside the box. For instance, they're looking at statins, the drugs people take for cholesterol. Turns out they might also help lower androgen levels in women with PCOS. And I'm sure you've heard about the new class of drugs, the GLP-1 agonists. They're showing huge promise for improving insulin sensitivity and helping with weight management. Beyond that, scientists are digging even deeper, looking at super targeted therapies to reduce inflammation, which gets us even closer to the real root of the problem. And this brings our whole story full circle, doesn't it? We're right back where we were a few minutes ago, the gut. I mean, if an out-of-whack gut microbiome can help cause PCOS, it just makes sense that fixing it could be a really powerful way to treat it. This is a huge, exciting frontier in research right now. They're studying everything from probiotics and prebiotics to, get this, fecal microbiota transplants, all as potential ways to manage PCOS from the inside out. Pretty amazing. So that leaves us with this really powerful, forward-thinking question. As science keeps untangling this incredibly complex web, is it possible that the future of treating PCOS doesn't lie in the ovaries at all? Could the real answer be found in that complex, thriving ecosystem inside our own gut? It's a pretty mind-blowing thought, and it's one that is totally redefining how we think about and how we might one day finally treat PCOS.